The global coronavirus crisis has affected social excluded people in Spain. Today, we visited a social dining room in the south, there where poverty rates have increased after the months of confinement due to COVID-19. More details in the following report by our correspondent Sergio Rodrigo.
The pandemic has fueled the hunger queues again. Raquel is a single mother of 2 children. She lost her job before the lockdown in 2020, and since then she has not recovered her job, which forces her to come to a social canteen to get food.
Since the pandemic began, I started coming here to the social canteen because I had no choice. I needed it because I have 2 children and I live with my mother, and the money didn't arrive, and we have to come here to the social canteen.
This social canteen is one of the largest in Spain and offers food for more than 500 families every day. The COVID-19 crisis has increased the number of families in need of food by 50%. Since the pandemic in March 2020, the number of people has doubled. We were feeding about 800 people, and we currently have 1,600 or more, of which there are about 500 families, and those 500 families we about 500 minors. The pandemic has aggravated social exclusion in regions such as Andalusia, where almost 3 million people are at risk of poverty. 35% of the total population of Andalusia is now at risk of poverty. Unfortunately, Andalusia continues to lead the Spanish state in poverty statistics. We have data with 10% higher than the national average, and also as always we emphasize that the face of poverty is still a female one, with a significant wage gap. Poverty is an effect of a system, and it affects everyday life such as access to housing, electricity bills, leisure or foreseen expenses. The pandemic has once again left a social gap between rich and poor in a country where social exclusion has increased but also the largest.
Sergio Rodrigo y Carlos Gil, teleSUR, España.